Hey, future counselor, it's time to study. Today we're going to walk through 25 exam questions focused on general drug topics. I'm Letitia. I'm a licensed professional counselor and licensed substance abuse treatment professional. I'm going to teach you everything I know so you can pass your addiction exam. In this video, you'll practice 25 exam questions together, me and you. You'll be able to strengthen your clinical and critical thinking skills, so by the time you take your test, it'll be a piece of cake. You'll be ready to pass that exam. Let's get started. What is the main effect of a depressant drug? It speeds up the central nervous system, slows down the brain and body functions, increases alertness and focus, or causes hallucinations. The correct answer is B, depressant slow brain activity. It will not be A because that would be more like a stimulant that speeds up the central nervous system. And C and D would be other drug classes. Stimulant drugs mainly affect which brain chemical? Serotonin, dopamine, melatonin, or it does not affect the brain chemicals. The correct answer is B. Stimulants increase dopamine, causing energy and euphoria. A affects mood, C affects sleep, and D is just simply incorrect. Which of the following is a hallucinogen? A, cocaine, B, LSD, C, nicotine, or D, alcohol? The correct answer is B. LSD distorts reality and perception. It will not be cocaine and nicotine. They are stimulants, and alcohol is a depressant. What does tolerance mean? The drug no longer works, needing more of a drug to get the same effect, feeling stronger emotions after using, or mixing drugs safely. The correct answer is B. Over time, the body adapts, requiring higher doses, needing more of a drug to get the same effect. Tolerance. What is withdrawal? Feeling high after stopping, the body's reaction when drug use stops, mixing two drugs together, or a type of overdose. The correct answer is B. Withdrawal causes symptoms when dependence exists. B. The body's reaction when the drug use stops. Which schedule of drugs has no accepted medical use? Schedule 1, Schedule 2, Schedule 3, or Schedule 4? The correct answer is A. Schedule 1 drugs do not have an accepted medical use. Schedule 1 drugs include heroin, LSD, and ecstasy. Which schedule includes drugs with some medical use but high abuse risk? Schedule 1, Schedule 2, Schedule 3, or Schedule 5? The correct answer is B. Schedule 2 drugs have medical use but a high abuse risk. Some examples of Schedule 2 drugs include oxycodone, fentanyl, and Adderall. Which route of drug has the fastest effect? Oral, injection, snorting, or skin patch? The correct answer is B, injection. Injection goes directly into the bloodstream. Which organ is primarily responsible for drug metabolism? Kidney, liver, heart, or stomach? The correct answer is B. The liver breaks down most substances. What is cross tolerance? Tolerance to one drug that reduces the effect of another similar drug, overdose due to mixing two stimulants, using a drug to avoid withdrawal, or developing allergies to a drug. The correct answer is A. Cross tolerance is tolerance to one drug that reduces the effect of another similar drug. For example, alcohol and benzodiazepines. Which drug is classified as an opioid? Cocaine, heroin, LSD, or marijuana? The correct answer is heroin. Heroin is derived from morphine and depresses the central nervous system. Which drug can cause stimulant psychosis with long-term use? Alcohol, methamphetamine, LSD, or cannabis? The correct answer is B, methamphetamine. Chronic meth use can lead to hallucinations and paranoia. Which drug is both a stimulant and a hallucinogen? A, ecstasy, B, alcohol, C, nicotine, or D, morphine? The correct answer is A. Ecstasy boosts energy and distorts perception. Which class of drugs slows breathing and heart rate? Depressants, stimulants, hallucinogens, or cannabis? The correct answer is A, depressants. Depressants like opioids and sedatives reduce vital functions. Which of the following drugs is legally available but highly addictive? Caffeine, nicotine, THC, or ibuprofen? The correct answer is B, nicotine. Nicotine is legal yet highly habit-forming, very addictive. Mixing alcohol with benzodiazepines increases risk of overdose and respiratory depression, hallucinations, anxiety, or hyperactivity. The correct answer is A, overdose and respiratory depression. Both depress the nervous system, making breathing slower or stop the breathing altogether. Which drug causes the most deaths worldwide each year? Cocaine, alcohol, tobacco, or heroin? The correct answer is C, tobacco. Tobacco-related illnesses kills millions globally. A client reports using cocaine to stay sharp. This is an example of dependence, misuse, addiction, or withdrawal. The correct answer is B, misuse. Misuse is using a drug outside medical or healthy limits. What is polydrug use? Using drugs from different sources, using more than one drug at the same time, taking a drug after withdrawal, or switching drugs to avoid detection. The correct answer is B, using more than one drug at the same time. Combining drugs increases overdose and interaction risks. Which of the following is an example of self-medication? Taking a friend's anxiety pill to calm down, taking vitamins daily, following your doctor's prescription, or skipping medication doses? The correct answer is A, taking a friend's anxiety pill to calm down. Self-medicating is using substances without a professional's direction. A pregnant woman who drinks heavily risks her baby developing neonatal diabetes, fetal alcohol syndrome, early puberty, or autism. The correct answer is fetal alcohol syndrome. Fetal alcohol syndrome causes growth, brain, and facial abnormalities. Which is a sign of opioid overdose? Dilated pupils, fast heartbeat, slow breathing and pinpoint pupils, or tremors and sweating? The correct answer is C, slow breathing and pinpoint pupils. Opiates slow respiration and the pupils become very small. Which symptom is common in stimulant withdrawal? Drowsiness and fatigue, rapid heartbeat, nausea, sweating and shaking? The correct answer is A, drowsiness and fatigue. Stimulant crash includes tiredness and sometimes depression. Which of the following is a harm reduction strategy? Encouraging total abstinence immediately, using sterile needles to reduce infection risk, ignoring drug use until a crisis, or punishing relapse? The correct answer is B, using sterile needles to reduce infection risk. Harm reduction meets clients where they are and focuses on safety first. Which statement about drug schedules is true? Schedule 5 drugs have the highest abuse potential. Schedule 1 drugs have accepted medical uses. Schedule 2 drugs have medical use but high risk for abuse. Or Schedule 2 drugs are illegal in all the states. Correct answer is C. Schedule 2 drugs have medical use but have a high risk for abuse. An example of a Schedule II drug is Adderall. We've completed all 25 exam questions. Watch this video as many times as you need so you can prepare to pass. There's a free study guide in the description. Make sure you download it. Also, subscribe so you never miss a study presentation. Thank you. I'll see you soon.